Hello, good afternoon. My name is Crystal Sylvia, and I will deliver a presentation on remote collaboration in evidence-based care. I will use the case study provided by Capella University. We will review the case study in the upcoming presentation, and a care plan will be presented. We will also discuss how a specific evidence-based model will help develop this care plan. Additionally, we will reflect on which evidence was most relevant when developing the care plan. We will conclude with the benefits and strategies to overcome the obstacles of remote interdisciplinary collaboration. Case study review. A man who identifies as transgender has been diagnosed by Dr. Smith with gender dysphoria. Following a behavioral health assessment, Dr. Smith informed the patient of the diagnosis. The patient lives in a remote area with limited access to medical facilities and services. The patient strongly desires to learn more about the possible advantages of hormonal and surgical treatments for treating their identified ailment. Dr. Smith arranged a virtual conference with seasoned experts in the field of gender dysphoria to work with. Dr. Smith, an endocrinologist, a nurse, a mental health expert, all collaborated. While Dr. Smith informed his colleagues that he believed the patient's condition required the introduction of hormonal and surgical treatment, he first sought input from the group before moving forward. Before starting these more intrusive therapies, the other three providers would prefer a more thorough evaluation to rule out other diseases that could mirror gender dysphoria. Dr. Smith concurs and plans to book the patient for a more thorough assessment. Care plan. Comparing transgender and gender diverse individuals to their cisgender counterparts reveals significant differences in their physical and emotional well-being. These differences show up as a higher rates of anxiety, sadness, suicidal thoughts and behaviors, substance misuse, and general poorer health. These differences can be linked, at least in part, to the negative consequences of discrimination and stigma faced by members of gender minorities, as well as their restricted access to high-quality medical care. Coyne et al. 2023. Working together with transgender and gender diverse people is essential for medical and mental health professionals to destigmatize gender diversity, assess barriers from the family and community, and determine what kind of help these persons need. Encouraging access to medically and psychologically appropriate interventions is also essential. The first step in the patient's care plan is a thorough evaluation to confirm whether the gender dysphoria diagnosis is accurate. The preliminary diagnosis is supported in the context of this investigation. The case report also states that after the diagnosis was confirmed, the medical professionals stated their plan to start hormonal and surgical therapy. It is not advisable to start treatment with a new patient in this way, as it could put them at risk for developing anxiety disorders, depressive symptoms, and thoughts of self-harm. Gender-affirming medical, surgical, non-medical, and therapy choices are typically presented stepwise, beginning with reversible treatments and progressing to partially irreversible and irreversible interventions. Coyne et al. 2023. When discussing the patient's care and creating the care plan, the providers must involve the patient in discussions about their health and adhere to the World Professional Association of Transgender Health Standards of Care, which can be found in PubMed's National Library of Medicine. It will also be crucial to discuss the ideal times for the team. It will also be crucial to discuss the ideal times for the team to communicate via telehealth. The provider should ensure that the patient has sufficient access to a private, secure area with a phone or computer and reliable internet service. Social interventions are what the care plan needs to include next. Social interventions are generally understood to be reversible actions that involve a person's lifestyle being in line with their gender identification rather than the gender that was biologically given to them at birth. The social transition process includes several components, including taking on a preferred name and pronouns, participating in cross dressing, and being allowed entry to facilities designed for sexes that correspond with the person's declared gender identification. Hurwitz 2019. Among transgender and gender diverse teenagers and young adults, the use of selected names in various social contexts, such as school, job, home, and friends, are associated with lower levels of depression, suicidal ideation, and suicidal behavior. Coyne et al. 2023. Medical and surgical therapy should be considered as a backup plan if social measures are unable to relieve the patient's distress related to their gender identity. The variety of medicinal and/or surgical techniques used to treat gender dysphoria depends on the distinct therapeutic goals of the patients. Patients frequently need to have a confirmed diagnosis of gender dysphoria, demonstrate that they can understand both the reversible and irreversible effects of the planned treatment, and have reasonable expectations about how the treatment will turn out before they can receive these therapies. Coyne et al. 2023. Medical and surgical therapy should be considered as a Coyne et al. 2023 outlines the potential patient's experience with hormonal therapy. Gender-affirming hormones, like testosterone, will cause the development of secondary sexual features that are compatible with their gender identity and are therefore desired. These characteristics could include deepening the voice and increased body and facial hair. Because testosterone causes both reversible and irreversible bodily changes, gender affirming hormone therapy is thought to be partially irreversible. Voice deepening is an example of an irreversible change, but changes in fat distribution are examples of reversible ones. Should the patient think about including surgical therapies in their care plan, Coyne et al. 2023 goes on to describe them. Surgical therapies for individuals suffering from gender dysphoria might involve several procedures such as masculinization of the chest, genital surgery that involves the removal of undesired reproductive organs, or the development of desired genital anatomy through surgery. Furthermore, face procedures might be considered a comprehensive therapy strategy component. Coyne et al. 2023. Evidence-based model. Coyne et al. 2023 provides a detailed description of the care model that must be used when developing plans of care for individuals who identify as transgender or gender nonconforming. The gender affirmative care model places a strong emphasis on supporting people in embracing their gender identity while avoiding bias towards any particular result and placing more emphasis on mental health. The therapeutic approach that is being suggested is based on cooperation and customization by design, recognizing that there is no one right way or universally appropriate approach for transgender or gender diverse people to follow when navigating both non-medical and medical interventions. If a person's gender identity and the sex they were assigned at birth disagree, it can cause discomfort or anguish, which is known as gender dysphoria. This could show discontent with one's physical appearance or how others view and treat them. In these situations, therapies meant to lessen gender dysphoria frequently entail helping people show themselves in public in a way that is consistent with their actual gender identity. Gender affirming therapies are a type of treatment that tries to lessen the distress that comes with gender dysphoria. Both non-medical, social, and medical surgical therapies are included in the gender-affirming interventions. Typically, a sequence of alternatives is provided for these interventions, starting with reversible, partially irreversible, and then irreversible therapies. Coyne et al. 2023. Most relevant evidence. A pertinent source is Coynes et al. 2023 study, which examines gender dysphoria in detail about various treatment choices, professional guidelines, key terminologies, standards of care, and potential etiologies. This peer-reviewed work was written within the last 5 years. The study was found in the PubMed database using the Capella University's library summon tool. Having a thorough understanding of the evidence-based theory to apply when treating patients with gender dysphoria made this resource helpful in developing an evidence-based care plan. PURIT 2019 was discovered using the Capella University Summon tool, ensuring the paper is peer-reviewed and published within the past 5 years. This article addresses the limitations of existing research while exploring potential causes, recognized hazards after diagnosis, and treatment options for gender dysphoria. Because it emphasizes the lack of information on this diagnosis and the necessity for healthcare professionals to seek to improve their training and conduct new research, this study is crucial to include in the care plan. It highlights the necessity of depending on a group of healthcare professionals collaborating to give the patient the best care possible. Stower et al. 2023. This peer-reviewed paper was published within the past 5 years and was located using the Capella University's library summon tool. The article is significant because gender-affirming telemedicine has the potential to enhance equity and access to care for transgender patients by utilizing digital technology to interact with patients and supplement physician education. Since the patient is remote and cannot easily reach specialists in person, this must be included in the care plan. Warner and Meta's 2021 research was also found while utilizing the Summon tool in Capella University's library. The article is peer-reviewed and was released within the last 5 years. It looks at the past of gender dysphoria as well as the obstacles that come up in the form of interpersonal, structural, and anticipatory hurdles when caring for a transgender patient. Having this knowledge is crucial for healthcare professionals looking for the finest approaches to guarantee secure and efficient treatment for individuals diagnosed with gender dysphoria. Benefits and strategies of interdisciplinary collaboration. When participating in remote interdisciplinary collaboration, people often face benefits and challenges. The patient lives in a remote area with no resources available to support them. The medical experts in the case study offered telemedicine as a way around these challenges. The patient and the healthcare team benefit significantly from using telemedicine in this specific situation as a communication and coordination tool for patient care interventions and interdisciplinary teamwork. According to a study by Stoller et al. 2022, telemedicine can help transgender people overcome several challenges such as limited financial resources and limited access to healthcare services. A virtual peer health consultation service, an electronic teleconsultation service, and an open online course on LGBT plus rights in healthcare for medical professionals and non-medical individuals are among the telehealth applications found. Stower et al. 2022. Given the dynamic nature of the healthcare industry, efforts must be made to effectively incorporate telemedicine into the delivery of gender-affirming treatment in the medical and healthcare domains. The interdisciplinary team may face several challenges when telemedicine technology is implemented. A prominent issue is the accessibility of internet connectivity and the technological resources required for the successful execution of telemedicine. To resolve the problem of inadequate internet access, it is advised that interdisciplinary teamwork, in conjunction with the patient, to set up suitable internet infrastructure and outfit the space with the equipment required to enable the efficient use of telemedicine. In addition, the patient could create a plan for well-established facilities with internet access and technology equipment already in place, such as a private room in their neighborhood library. Understanding the scientific evidence supporting recommended medical therapy and being aware of the limitations of this data is crucial for providing sincere and long lasting care to individuals with gender dysphoria while abiding by ethical rules. To provide patients with gender dysphoria with long term assistance that complies with ethical standards, it is imperative to fully understand the scientific evidence supporting recommended medical interventions and acknowledge the inherent limits of this data. Existing transgender literature has various limitations that need to be addressed. These drawbacks include the lack of a randomized prospective trial design. The sample sizes are too small, biased in recruitment, have short research durations, have high subject dropout rates, and rely on subjective expert opinions. Hurds 2019. Several structural obstacles face transgender healthcare, including high rates of uninsured or underinsured patients receiving transgender specific services, a lack of education among doctors regarding transgender sensitive care, and a shortage of providers providing transgender related care. Several strategies can be put into place to address barriers in transgender healthcare effectively. These actions include changing healthcare insurance policies to cover gender affirming medical care, updating medical school curricula to provide future doctors with the knowledge and abilities to treat transgender and gender nonconforming patients, and offering continued education to healthcare professionals. Warner and Meta, 2021. Conclusion. Implementing evidence based practice in creating a gender affirmative care model, emphasizing interdisciplinary collaboration, would improve the patient's overall well being. Effective collaboration would promote thorough education regarding patient therapy, improve patient support and comprehension, and raise provider awareness. Evidence based research can help execute a carefully crafted care plan that provides a more efficient and patient centered approach to delivering medical care. Thank you so much.